You work in KwaZulu-Natal. You're a doctor and an anaesthetist intern. Kirsten, and you're also one of those people who are out on strike at the moment. Just to go back a little bit, the public believes, or the public's got the view that you've been offered a lot of money as doctors, 50% increases of what is being suggested, and yet the doctors are still striking when you've all signed Hippocratic oaths and you're supposed to be doing anything else but going on strike. You're supposed to be looking after sick people. What's got to the situation that you've had to take this radical action?
Well, the first thing is the actual implementation of the OSD.
What's the OSD?
This is this pay rise, which is this occupational specific dispensation, which was basically instituted by the government, and it was to improve each person who's employed by the government in different specific occupations a pay rise. The numbers that were released to the public look good on paper. Yes, it looks like it's between 20 and 60%. But our salary is structured. It's made up of basic, overtime, scarce skills. If we were getting the 60% over that and above that, that would be great, and that's what we want. But what they haven't let the public know is that they've actually collapsed the rest of our salary down, and then this OSD comes on top of it. So when the numbers are crunched, it actually works out to like a 2% increase. Well, it varies between like a 2 and 20% increase, depending on the level that you are in.
Wow. So the numbers then don't work out as far as the salary increases. But reading through the correspondence and talking to other professionals in your field, there seems to be a whole lot more behind this than just pay.
Well, yeah, it's basically there's a crisis in the state hospital sector. We are working under poor conditions. The pay is a big issue. Obviously, we can't retain staff. Our senior staff, who are our specialists, who are our teachers, who have the knowledge, have 20 years of experience, they have no incentive to stay in the government sector. They prefer to go overseas. Private pays, 300% more than they get in the government sector, and this ultimately affects us and our treating the patients.
Reading through some of the complaints, one of them that struck with me, and David, I think you would also find this interesting, is the allegation that there's incompetent government-appointed managers and administrators who accept kickbacks, buy the wrong equipment, and allow patients to, be treated in substandard conditions. Why hasn't this been reported before? Why does it have to come out in industrial action?
I don't know. It's just obviously something we've just gone on with time. And now the fact that
there's no one listening before.
Well, I don't think the doctors were actually coming to the forefront before. It's now with this underpayment, and we realize that it's not just our underpayment, it's also the poor working conditions we're working under, lack of equipment, malfunctioning equipment, and, all this adds up together, and something needs to change, and needs to change now. Otherwise, we're going to get a crumbling in government health.
Kirsten, why do you work for the state when you could go to the private sector at 300% more? And why do your colleagues, why are they still working for the state?
Well, this is what you have to clear up a little bit, is when you qualify as a doctor, you have the choice of either going into the private sector, and you can only go into GP practice then. I've chosen to do anaesthetics. In order for me to work in the private sector in anaesthetics, I have to do 4 years of training as a registrar in a government hospital, okay? And only once am I a trained specialist with that qualification am I allowed to go into go into private. And at this point, I think I've got 2 more years left, and then I'll be qualified, and I have no incentives to stay in the government. I will either move into private, or I will go overseas, and that leaves a huge gap in government.
What about the people who are teaching you, training you in the state sector?
Well,
what is their incentive to stay?
There isn't. There's just some very dedicated people who, they were born to teach, and that's their passion, and they stay, and they they feel that teaching and providing medical facilities to the poor is more important than money. But unfortunately, that's not the way it is in real life. And most people go where there's more money. And if there was just a little incentive to stay, in the government, then you would find a lot more doctors staying there.
The point I made to David Shapiro earlier about school friends of mine who just simply, they've left, most of them, many, many years ago. Is it still a situation now that your class, perhaps, that graduated, are they sticking with the
Definitely.
country?
I have loads of my colleagues from varsity are either specializing overseas, or a number of them have already specialized and are overseas. You know, and it's just a sad state of affairs. You know, I worked for 3 years in the UK once I graduated as an anaesthetist working there. You know, and I made the conscious decision to come back and work here, and now I'm thinking I'm going to do my 2 years and then I'm going to go again.
David, there is a skill shortage all around the world. Medical doctors
Yeah.
in massive